Ashford University Online Classroom, Healthcare Administration 322, Healthcare Ethics and Medical Law. Week 2, Discussion 2. Hello, my name is Stacy Boyer. The date is April 23rd, 2015. I will be playing the part of the defendant, Ashford Hospital, in our courtroom drama case, Patient versus Ashford Hospital. A patient who was both a patient and an employee of the hospital alleged that her protected health information was impermissibly disclosed to her supervisor. Ashford Hospital distributed an OR schedule that contained information about the patient's upcoming surgery. The information disclosed but was not included to her social security number, her date of birth, her insurance and payment information, former surgeries, her medications, past medical history, primary care physician, and other health professionals that she had come in contact with in the last year. The patient's supervisor was not part of the OR team or the patient's treatment team, but was considered to be in a senior administrative position within the hospital. The suit being brought at hand is the patient is suing Ashford Hospital for improper release of her health information protected under the privacy rule. I will try to prove that no legal or ethical standards were infringed upon by Ashford Hospital. Ashford Hospital was following procedure when they sent out an email of the operating room schedule. This procedure is done in preparation for all surgeries performed in the operating room for the purposes of hospital staffing, knowledge and expertise, and supplies. The information contained on the operating schedule was needed information to perform and complete the surgeries that were listed on the schedule. The person's name, the social security number, the date of birth, insurance payments, former surgeries, medications, past medical history, primary care physicians, psychiatrists, and other medical professionals. These are all important parts of the patient's medical information chart, which nowadays is electronic. So I'm going to begin with privacy. What is privacy? Privacy refers to an individual's expectation to keep or control access to his or her individual space. The right to privacy is allowing access to this private sphere. Now, the right of privacy is also common law. There is no universal statute in place. The Supreme Court in 1956, the court case Hosh versus Puff, in which the right to privacy is the right of a person to be let alone, to be free from unwarranted publicity, and live without unwarranted interference by the public in matters with which the public is not necessarily concerned. And second, this is very important, an actionable invasion of the right to privacy is the unwarranted appropriation or exploitation of one's personality, the publicizing of one's private affairs with which the public has no significant legitimate concern, or the wrongful intrusion into one's private activities in such a manner as to outrage or cause mental suffering, shame, or humiliation to a person of ordinary sensibilities. Here, with this case lies the fact that no crime was committed in transferring the OR schedule via email. There was no breach of privacy or confidentiality enacted. Najut Kalik, in 2012, in the Digital Footprints in the Context of Professional Ethics, notes there is no universal law protecting the privacy of online users. The patient allowed using her right of privacy, her private information to be electronically inputted into the Health Information Network for the purposes of health electronic records. In 1996, the Health Information Accountability and Portability Act, also known as the HIPAA Privacy Rule, provides federal protections for individually identifiable health information held by covered entities and their business associates, and gives patients an array of rights with respect to that information. However, at the same time, the privacy rule is balanced so that it permits the disclosure of health information needed for patient care and other important purposes. So in conclusion, Americans do value innovation. They like the technology and the technological advances, where technology can mean better health with less costs, and even if it might mean your personal health information is exposed. The risks of having medical care opposed to not having medical care far outreach the risks of a secure health network. The health information that can be shared should have access security measures for need-to-know only basis. I do not believe any legal actions were hindered, because it's electronic knowledge that needed to be passed on so that her medical needs could be taken care of. Thank you. Stacy Lloyd.